مرض كان بدأ معي لفراحس والصداع ورقبتي والظهر.
The sickness first starts with she was feeling drowsy, and then pain at the neck and at the back, and then the stomach. That is how it is started.
Malaria is a leading cause of morbidity and mortality in southern Sudan, and especially among children under 5 years old and pregnant women. In every 3 patients attending health facilities in southern Sudan, one of them is complaining of symptoms and signs pertaining to malaria.
It starts with fever and coughing. So they had to rush with the child to the health center here for further examinations. And they found that the child is malaria positive.
Malaria كان مصابة.
She suffered from malaria 2 months ago, and she has suffered again. Now she's heavy, and what it means by heavy means pregnant. Yeah.
The type of malaria we have here, the falciparum malaria, could lead to cerebral malaria. Then it can cause some damage in the brain, and now that would render the child not capable to progress in school and grow as an adult without education, and so that comes back to the society and to the community. You know, in our African culture or in southern Sudan, women are the one taking care of almost every member of the family. In many of our areas, they are the one who go out fetch water. They are the one who go out fetch, firewood. They are the one who cook for the family. You can see if a child in the family is sick, not even a child, if a member of a family is sick, it generates, a series of other social issues. The Ministry of Health, Government of Southern Sudan, opted to source the Population Service International to undertake this particular component, first because of their involvement in similar work. When we started the campaign, we were not sure whether we are going to really succeed or not, but one thing we know very well is that we need the nets to get there.
The nets that we receive is 1,062,000 nets. They say it is the first time in the history of Sudan for them to receive free nets.
First challenge was to actually get storage in Juba, because this country has been at war for a long time and there's not much infrastructure in place. At the same time, we went around the 3 states we were targeting, which was Warab State, Western Bargazal State, and Western Equatoria. The conditions of the roads are really, really, really bad. But we're up to the challenge of making sure that we may get the nets to all the locations before the rains. Because once it rains here in Southern Sudan, it's almost a no-go. In a period of a week, we had, I think, like 25 trucks on the road. To organize that was quite something.
I was able to make things smooth and make sure nets reach every village, whether it is being carried on head, bicycle or motorcycle.
It felt good that at least we achieved to get the nets to all those locations. It wasn't easy, but I think it was worth it.
Agura mamjaya magura ki kalgani magura what
just hang the mosquito net under this tree. The time that distribution of mosquito nets were not taking place, the people of our area here, they were being suffering. Now we feel happy for what you brought us, mosquito nets, to protect us from mosquito.
It's very exciting to really know that these nets are already there, you know, in the tukals of our people in those remote areas, and fulfilling to know that now these nets are there and they are protecting our children and women from getting malaria. Most of all, to get over 1 million nets out there to needy people is very encouraging. In fact, one of the objectives of the mass nets distribution is to create a culture of using mosquito nets in our communities. We will even be happy to see people coming to us and asking, where are nets? Our nets are getting old now, you see. So it's a long way, but we are going to get there. Hopefully we are going to get there, especially that after this experience, now it is known that it is possible, it can be done, it's effective.